Hello, my name is Riley and my partner is Sierra, and today we will be presenting on the condition known as lymphedema. Throughout our presentation, we will go over the following: a review of the lymphatic system, what lymphedema is, the causes, signs and symptoms, diagnosis, risk factors, treatment and preventatives, a case study, and our references.
Recall that the lymphatic system is part of the immune system and consists of a network of organs and tissues that remove toxins, waste, and unwanted substances from the body. The primary function of the lymphatic system is the transportation of lymph throughout the body, which is responsible for containing infection-fighting white blood cells. Throughout our presentation, we will look at a condition in which the lymphatic system has become disturbed due to the removal of lymph nodes or blockage of lymph from draining. And here is just another image that we've learned throughout the course of anatomy, just understanding the lymphatic system, including the tonsils, adenoids, spleen, and thymus. So what is lymphedema? Lymphedema, also known as lymphatic obstruction, is a chronic condition recognized as swelling caused by the accumulation of lymph fluid within the tissues. This condition is commonly caused by removal or drainage to the lymph nodes, especially as a form of cancer treatment. A blockage within the lymphatic system usually occurs as the result of the inability for lymph fluid to be drained, causing swelling. The condition can be categorized into two types: primary and secondary lymphedema. Primary can be abbreviated as PLE and secondary as SLE. Both of these relate to damage, removal, absence, or impaired lymph vessels or nodes. Primary lymphedema is inherited because of a defect of the lymphatic system in fetal development. Secondary lymphedema is caused by lymphatic damage after birth from things like cancer and its treatment, radiation, injuries, and/or burns. And here you could just see the amount of lymph nodes that travel throughout the body through our lymphatic system.
The causes of primary lymphedema include Milroy's disease or congenital lymphedema, Maje's disease, also known as lymphedema praecox, and late-onset lymphedema. A mutation in the FLT4 gene, the gene responsible for making the protein that regulates the development and maintenance of the lymphatic system, is inherited in an autosomal dominant manner. A mutation in this gene causes Milroy's disease, where lymphedema is present at birth and is characterized by the improper formation of the lymph nodes. With Maje's disease, this disorder causes lymphedema around puberty or during pregnancy. The normal function of the lymph nodes are affected. This disorder is thought to be genetic as well, but there is not one specific cause or mutated gene of Maje's disease identified. In late-onset lymphedema, it occurs rarely and is present after the age of 35. It is also thought to be hereditary, however, it is not linked to a specific gene. Again, secondary lymphedema occurs after birth due to damage of the lymphatic system caused by radiation therapy, producing scarring and inflammation of the lymph nodes. Surgery to remove lymph nodes to check for spread of a cancer may injure other lymph nodes that involve blood vessels in the limbs. Lastly, infection of the lymph nodes can restrict the flow of lymph fluid. This cause of lymphedema is more common among developing countries. And in the figure to the right, it just shows an infant who's presenting Milroy's disease, which is causing lymphedema in their lower limb.
Symptoms can be present anywhere in the body, including your head, chest, and genitals, but most commonly are found in the arms and legs. The most common symptom is swelling, again mainly in the arms and legs as well as fingers and toes. Swelling due to lymphedema can be mild, where a patient suffers minimally and hardly sees any drastic changes in the size of their limb. Swelling can also be severe, which is pictured here at right, where the right foot has become insanely swelled. And this can cause the limb to become difficult to use. Other symptoms include heaviness and tightness. For instance, if a ring or shoe suddenly feels too tight where it no longer fits. Also, aching or decreased mobility due to increased weight of the swollen limb. Infection with signs of redness and fever, and or a pins and needles sensation, which causes pressure on the nerves, which then induces swelling.
When diagnosing lymphedema, the most useful technology is lymphoscintigraphy. Lymphoscintigraphy helps evaluate the lymphatic system for disease using small amounts of radioactive materials or radiotracers. These are typically injected directly into the skin, where they travel through the area being examined and produce energy as gamma rays, which are detected by a special camera and adapted into an image. In the figure to the right, you can see 3 stages of adapting lymphedema using lymphoscintigraphy. In image A, the scan is conveying collateral circulation. This is a sign of an obstructed lymph flow. In image B, this indicates the presence of lymphatic leakage. Image C represents dermal backflow. The increased pressure causes lymph fluid to flow backwards, then leaking out into the tissues. This image clearly shows lymphedema. Other methods of diagnosis include MRI scans, which produce 3D high-resolution images, CT scan, which produces cross-sectional images, and Doppler ultrasound, which uses high-frequency sound waves to bounce off of red blood cells and examine the blood flow and pressure in the lymphatic system. Specifically for primary lymphedema, pitting edema is an indicator for early diagnosis. This process includes pressing a finger into the swollen area and then removing the finger. If the finger pressure creates an indentation within the tissue and gradually disappears, this is a sign of primary lymphedema. Stemmer's sign is a thickened fold of skin at the base of the second toe that is able to be lifted when pinched. Stemmer's sign is positive when the tissue is unable to be lifted, which is often an early indication of primary lymphedema, which is able to develop into secondary lymphedema. The test is negative when the tissue is able to be normally lifted.
Lymphedema is a common side effect of cancer. Those who have previously been affected by cancer, undergone cancer treatments like chemotherapy, which have been seen to cause weight gain, have been exposed to radiation, especially in the underarm area, as lymph nodes are highly clustered here, or have had lymph nodes removed, are most at risk for developing lymphedema. Lymphedema can be a problem after almost any cancer, although it is most common from breast cancer, melanoma, prostate cancer, and pelvic area cancers. Other risk factors include surgeries, as it can disrupt the lymphatic system, obesity, because areas with higher fat accumulates more fluid, infection and/or injury, as it causes the body's tissue to become inflamed, and in turn causes the lymphatic system to work harder. If the lymphatic system cannot keep up, lymphedema is triggered, old age, and rheumatoid arthritis. There is no definite way to prevent lymphedema, but there are ways that help lower your risk. It is important to avoid anything that will harm the affected limb, especially after any cancer treatment. Things to protect and/or avoid include avoiding injury of the infected limb as it can invite infections, avoid heat as heat can damage structures of the lymphatic system located beneath the skin, request blood pressure to be tested on unaffected limb, as blood pressure cuff can cut off circulation and damage the delicate lymphatic tissues, regular exercise which stimulates flow of lymph, and maintain good skin hygiene. Axillary reverse mapping, or ARM, is a technique where blue dye is injected into the upper arm at time of surgery. This dye allows direct visualization of lymphatics in the arm and nodes during sentinel lymph node biopsy, or SLNB, and axillary lymph node dissection, ALND. SLNB is a surgical procedure most commonly used in breast cancer and melanoma patients, which causes an injection, contains a tracer material used to locate sentinel nodes, which is the initial most common place cancer spreads. The sentinel nodes are removed and analyzed. If they are cancer-free, cancer has unlikely spread, and removing additional lymph nodes is unnecessary, which reduces a patient's risk of developing lymphedema. ALND is simply the removal of axillary nodes with suspicion of cancer. The least amount of node removal is ideal as it reduces a person's risk of developing lymphedema. And here is just pictured the process of removing the sentinel nodes, where the dye is injected, which then allows them to identify where the sentinel nodes are. And then through surgical removal, they're able to remove and evaluate those nodes. Currently, there is no cure for lymphedema, but several treatments are used to control swelling and pain. Regular, light exercise that induces gentle contractions in an affected limb can aid drainage of lymph fluid. Compression garments, such as a sleeve, can be used to compress the arm or leg to encourage movement of lymph fluid. Another type of compression is known as pneumatic compression, in which a sleeve connected to a pump that irregularly inflates the sleeve is worn over the affected limb to apply pressure that moves the lymph fluid out of the area. Aside from treatment you can apply to yourself, other methods are available. For instance, a massage known as manual lymph drainage, or MLD, can encourage flow of lymph fluid out of the area. Another technique is known as complete decongestive therapy, or CDT, which is pictured here to the right. This intensive therapy is divided into a decongestant phase and a maintenance phase. The decongestant phase aims to return the limb back to its normal size through manual lymph drainage, a special massage, compression therapy, exercise, and skincare, as good hygiene and care is important to avoid infections. The maintenance phase contains the same 4 components previously stated in the last phase that aims to preserve the results of the decongestant phase.
In this case study, a woman named Ms. K, who is 69 years old, is referred to a physical therapist for treatment of her bilateral lower extremity lymphedema. Her symptoms included swelling on her legs, and the skin was hard and fibrotic. She was observed to be overweight for her height, although her BMI was never taken. Before treatment, Ms. K was given education on the lymphatic system. Her physical therapist suggested MLD massages every day, which are a type of light touch massage to help stimulate the flow of the lymph fluid in her legs. She was also given a compression wrap to wear on the area 23 hours a day. During the hour she isn't wearing the wrap, she must clean the area with antibacterial soap. Remedial exercise was also recommended to help lymph fluid flow. During Ms. K's 2-week checkup, it was observed that the lymph fluid had reduced. She went back 2 weeks later and again continued to decrease the amount of lymph fluid buildup in her legs. The point of this study was to determine if MLD massage and compression wraps were useful in decreasing lymph fluid buildup. From the results, we can conclude that daily massages to the infected areas and constant compression from the wrap does reduce swelling from lymph fluid. Here are our references. Thank you.